Why Oak Street?
Yeah, so think about December 2021. We basically laid out a comprehensive strategy that we wanted to extend into health services. And we were clear in our articulation saying that we want to be in primary care, we want to be in the home, and we wanted to have provider enablement capabilities, all really so that we could build a vertically integrated ecosystem to support improving the overall health care of Americans. And we basically have executed on that strategy, and today, as you know, we announced Oak Street Health, and we were very comprehensive in our assessment of our primary care capabilities. What we said we wanted to do was we wanted to have the right technology, the right management, the right ability to scale, and this asset hit every single one of that criteria, and we feel really good about Oak Street, and we're very excited about what this transaction will do for the company and for the future growth of our company.
Investors feel good about it, too. The stock is up nicely. Karen, I think that analysts they talk to are bullish on the idea that all these services that now you offer can be integrated, and you can see a lot of synergies there. But how heavy of a lift is that going to be?
Well, first of all, we actually have to close our transactions with Signify and with Oak Street. But what we have is really the premier multi-payer value-based care assets between Signify and Oak Street. And the way to think about this is really think about Signify Health. People are in the home and they determine that one of their patients need primary care. They have the ability to refer that patient into primary care. And then when we continue to evaluate their opportunities, we have assets that in our Minute Clinics and our health hubs that can have additional capacity, that can have extended care services, and then we can really wrap around all of our services, including our specialty pharmacy. And anything that we do will support our Medicare Advantage members and also our customers, because this will be a payer-agnostic approach.
I was wondering if you anticipate any regulatory pushback here. I know you said it's all vertically integrated, so no real competition, but obviously a huge Medicare population that we're dealing with here.
Yeah, these are complementary assets, and they're extending businesses that we aren't currently in. So, obviously we're going through the process in Signify, and we're very much down the path, and we anticipate that this will close at the end of 2023.
And one thing you're getting here that you don't have is doctors, right? And nurse practitioners. And is that a good business to be in?
Yeah. Well, remember, primary care, although it is a small portion of the overall healthcare spend, it wields significant influence on total healthcare spend. So if we have this asset combined with all of our other assets, we have the ability to improve quality and reduce overall healthcare costs, and this is part of the comprehensive approach to healthcare. And this is an important asset for us.
Yeah, I want to talk about the quarter also, Karen, because your earnings were beat, revenues too. How much of it was the impact from what we've all been experiencing this winter, a tough season of COVID and flu and RSV and strep and all the other things that my kids have brought home?
Well, the good news is, Sarah, we have beat and raised every single quarter this year. Every one of our foundational businesses performed well. We had strong results in our healthcare segment. We had strong results in our pharmacy services segment, and we had strong results in our retail segment. So overall, the foundation is exceptionally strong. And also what's underappreciated with our business is we had very strong cash flows of $16.2 billion.
So where are you on COVID? Because it does feel like for vaccines and treatments, there is a decline in terms of the uptake. How do you map this out?
Yeah, so obviously COVID's on the decline. We are expecting significantly lower COVID-related results. We expect to see lower OTC tests, and then we expect to see annual vaccines for COVID and for flu. But we've been doing a lot in our businesses because we knew this was coming. We've been improving the operations of our retail locations, improving through expense efficiency. efficiencies, changing our merchandise, and really using technology to improve the customer interaction with us, as well as our operational efficiency.
How's the pharmaceutical supply chain, which, like so many supply chains lately, has been tested, and we've seen shortages of key drugs?
Yeah, for now, we've got very strong in stock. There are certain parts of pharmaceuticals that have been pressured, but overall, the performance of our supply chain is very strong.
And finally, just wanted to ask you about a story that's been percolating in the last few days. 20 attorneys general warning you and Walgreens against selling abortion pills. And I'm curious what your position here is, Karen, and whether you're dispensing those pills currently.
Yeah, so we're a healthcare company, and our goal is to provide affordable access. We have our North Star to make sure that women have access to healthcare products and healthcare needs. And obviously, we pay attention and follow every state and federal law.